For about a month, I was having night sweats, waking up drenched in sweat. It became chest pain and back pain. An x-ray, looked funny. My blood looked funny. I saw Dr. Shanduri after my biopsy. He said, I wish I could tell you it's just a really bad infection, but it looks like cancer. I just started crying, because that's when it felt real.
She brought my mom and my sister to the room, and she straight out told me, "You have cancer." And it was shocking. I cried, my mom cried.
I came in feeling very frightened, like most people do, not knowing what to expect and, what's going to happen. And
first thing they are is they're scared. We have to calm them down and tell them, hey, we'll do something about it. We'll figure out the best way to treat you.
The treatment is personalized. That's a big deal for the patients. They don't feel that they are just any other person in the cancer center getting treatment. We like to know the patients personally.
For you?
I'm doing well today, thank you.
You are not a number, you are a person here.
So this is about 4 years since we treated you.
We have some of the best machines in the world. We have some of the best technology in the world. There's almost nothing that we cannot do and provide for our community at this hospital.
Anything that's approved by the FDA, we have it. We are a coordinated program. We have social workers, we have trained nurses, infusion center right on site. We treat patient as a whole.
How are you doing, Mr. Lee?
Well, I'm doing fine.
You're doing okay.
I was diagnosed with ovarian cancer second time around, but at a very early stage. I'm very blessed. I work at the hospital, so this is my place to be. I wouldn't want to be anywhere else.
Do you want another blanket or is this good?
As soon as I walked in here, I knew I was in good hands.
This is the copy of the blood count.
Everybody's so kind and so professional. The staff are so nice. It's just an incredible place. I like coming here. I'm serious.
When I started here, I couldn't breathe, I couldn't talk, I couldn't swallow, I couldn't eat, I couldn't smell. After my first treatment, I was able to go home, sleep through the night for the first time. I woke up to the smell of garlic and breakfast and bacon, and I knew something had happened overnight just with the one treatment. I was crying the whole time, and my wife's cooking in the kitchen, and she sees me, "What's wrong?" I can smell this. And she looked at me, and we just both started crying, and I had the best breakfast anybody can cook that day.
I think when Robin and I walked in the cancer center together for breast cancer, we were impressed with the sensitivity, the directness, their very sincere compassion.
That's what we do here.
Robin was really resisting the idea of chemotherapy. And Dr. Shanduri leaned over and put her hands on Robin's knees and looked right in her eyes and said, "Robin, this is really, you need to do this. This is very, very important." And that touching, that comforted Robin, and she said, "Okay." I just, it was a moment, and she's perfectly clean after 5 years now.
How long have you been since the last time I saw you?
The Robert and Beverly Lewis Cancer Care Center was stimulated by this idea of caring for the whole patient and the family. A big part of that was the endowment that would provide not just for facilities, not just for equipment, but more importantly to provide for those services that would not be funded by insurance.
Arnetta, let's go ahead and try this. Just hold it up front on your forehead, okay?
Okay.
Everything you need, they have. They provide you with everything, support groups, yoga classes. It's good to know that you're not alone. They have your back, and it makes you feel welcome.
Any service we provided in this hospital, in the cancer center, has got to be good enough for me and my family, or it isn't good enough for anybody in the community. That is, we live that.
They don't just feel like family, to me they are family now. I think the way they are with me definitely has helped my body and helped me heal faster than expected.
I love this place. It's really hard. It's hard to explain. I would not wish cancer on anybody, but being here makes it okay.
After they finish, they ring a bell. It's like running a marathon and finally crossing the finish line. They're looking forward to that day that they get to ring the bell, that they get to say, "I'm done."
You don't really realize it until you ring the bell that in all the time you were having your treatments, you're kind of holding your breath.
So comforting. You had the biggest words for me when this whole thing started. There was absolutely no doubt in your mind that you were going to make me feel better. And guess what? You did. All you guys did.
I mean, I'm not gonna miss cancer, but I'm definitely gonna miss the people who helped me get through it.